What makes this place such a pleasant experience is we have a great staff, but more importantly, we have a brand new advanced wound healing center up here on the second floor.
We have the 2 hyperbaric chambers. We have 5 rooms to see our patients in. We have a capability to handle bariatric or very heavy patients. We have capability to take care of podiatry patients. We've got 3 podiatry chairs.
We heal primarily chronic wounds, patients that have had mostly 30 days or longer, and our physicians, we have 6 panel physicians that are trained to help these patients.
We want to try to really jumpstart and kick these wounds into healing. We eat, sleep, drink, and breathe this. Really, when the patients are gone, we're talking about, now, what could we do to improve outcomes with this patient? You know, when you have a wound healed that's been there forever, or so it seems to the patient, their quality of life improves immediately because the pain is reduced, because the things that they've been limiting themselves from doing, or the wound itself prevented them from bathing. They could maybe shower, maybe not, but now they can actually soak in a bathtub. They couldn't play with their grandchildren anymore, and now they can.
A hyperbaric oxygen chamber, by its name, is a chamber where we give treatments to patients and they breathe 100% oxygen at a pressurized depth. When you inhale and breathe that oxygen for a period of time, you're infusing, so to speak, oxygen into your system, into your blood system, which increases the oxygen in that wound tissue or wound site 10 to 20 times more than you would by breathing normal oxygen. Normally what would happen is I would have a doctor's order. Then in addition to that, I would have an orientation time for the patient where I would go over the steps that they need to take, which would be putting on our garments similar to what I'm wearing, scrubs or a gown, hospital gowns. Before they would go into the chamber, we'd take their vitals. In the event that they're a diabetic person, we would take their blood sugar and the doctor would see them. And then we would put them into the chamber and do a hyperbaric treatment. What they're going to feel like when they're in the chamber, if someone has flown either in a commercial aircraft or they've been to the mountains, they'll have a feeling that maybe their ears have popped a little bit. That's probably the only feeling that you're going to have as far as an effect of this diving or pressurization. Normally the treatments that the doctors prescribe would be 90 minutes at depth, and what that means, once the patient is pressurized, which means that they're at 14.7 pounds per square inch pressure, then we begin the 90-minute treatment. The time it takes to get from 0 to 14.7 is approximately 10 minutes, and for coming up, it's approximately the same. So you're, in essence, you're in the chamber for 90 and another 20, so you're in there 110 minutes. We have a very open chamber room. The chambers are 100% acrylic. The patient can see out. It's not like an MRI. It's very open. If a person's a little bit claustrophobic, I can walk them through it. I'm sitting right next to them. I never leave their side. I'm always observing them. I can talk to them on the phone. They can talk to me. Some like to watch TV, so we can have the TV on or we can have the TV off. They can nap, and obviously I wake them up when the treatment is over. What we're looking for, we're looking to heal the wound that the patient has presented with. The number of treatments vary. It could be as little as 10, could be as many as 30, could be even more than that, depending on how the patient progresses and what the doctor feels is necessary in order to heal that wound.
If I had to choose a wound care center to go to, I would want to go to one that truly practiced advanced wound healing.
We want to heal the patient totally, regardless of whether it takes one piece across the hall or another piece here or a combination of things.
I had a patient who has just absolutely been distraught over his wound care over the years and with other places. And today before they left, they both stopped and came back in the room, he and his wife, and hugged me and told me, "Thank you." I said, well, thank you, but why are you thanking me? And the patient's wife said, because you've given us something that nobody else has been able to. They got their hope back, and they are healing. Now, every case is not going to be perfect, but just to have your hope restored and to see progress that doesn't have to be explained in scientific terms, but is visible in the eyes of any patient that comes in and they look at their wound. They can see that their wound is getting better, and that's just a very huge relief.
We're very excited to have this facility in our community and to help patients improve their quality of life.
We can save a lot of limbs, especially in the diabetic patient.
We are here to provide you with a comprehensive, progressive plan of care that's going to figure out, first of all, why do you have this wound that has not healed and how to correct that. But we're not going to stop until we get to the bottom of it, and we're not going to stop until we have you healed.